Hello, my name is Shyra Moody, and this is my response to the video titled Needs and Challenges of Disaster. As I watched the video interview, initially I didn't realize the person being interviewed was from a church for a crisis center. So as I continued to watch and take notes, I realized the disaster was Hurricane Katrina, and I realized the speaker was part of the crisis team during and after the disaster. I will discuss the important details of the video and my reflection on the phases that were addressed: the heroic phase, the honeymoon phase, and the disillusionment phases, and reflect personally about what I saw in the video. I'm also going to reflect on my observation of the interventions listed in the video. I believe understanding these phases and especially the interventions of each phase helps us to be prepared to help survivors in of disasters and crisis. So my reflection on understanding the heroic phase. After the natural disaster of Hurricane Katrina, based on the video, I will list exactly what I read from the display video notes. So, in the needs and challenges in this phase, during the heroic phase, disaster survivors may deny the impact the disaster is having on their homes, deny the impact the disaster is having on them and their families, utilize extraordinary measures to protect their homes and families, and stockpile community assets. So, the interviewer stated that people don't understand it's a long term event. People were exhausted trying to get through the true needs and magnitude, and people throw themselves into helping others and getting things rebuilt. So they kind of get in that denial phase as they're helping and processing it. So spiritually, the video discussed that there's a greater sensitivity to the Lord because people who are helping love Jesus and they were really open about their spirituality. So that was present. And emotionally, they were still in denial and didn't see the long term picture, using denial as one of those coping mechanisms to help them get through. So they have the energy to work hard, but then they are still needing the self care energy there, even though they're in the denial stage. The video also kind of discussed how the denial stage is needed so that they can push through, and I thought that was important. As I reflect on the interview discussion, the heroic phase requires responders to jump right in, to take action, providing physical and emotional help. Emotional help is needed due to the survivors. They still may be in denial, but they must be reminded of the self-care that's still important, because they can get physical exhaustion and get re-traumatized or get burnt out if they're a first responder. Now, my reflection on the honeymoon phase and the risk of the crash point. So, based on the video during the honeymoon phase, and once again, this is reading directly from the video slides, disaster survivors may feel the following sometimes unrealistic feelings during this stage. One would be having great gratitude. Two, everything is going to be okay. Three, focusing on like feel good stories. And four, normalcy as possible. The interviewee stated that people realize their body will shut down. So after Katrina, many of the elderly died after the disaster due to physical ailments and heart attacks. Their body just couldn't take it because they were older. So after the crisis, many survivors go into this honeymoon phase. This is when people are uniting in a way to recover and feel better. In the book Fundamentals of Crisis Counseling, Miller states that the honeymoon phase is the key window for intervention, which is why I also want to talk about intervention in the video. If there isn't sufficient intervention during this stage, there's a risk of decline in survivors. The video described this as a shutdown or burnout. But I realize that this is a crash point. This is where the survivors are affected. The whole community is affected. The first responders and volunteers will need emotional support. They all need emotional support during this time. This usually happens a few months after the crisis. There are several reasons during the honeymoon phase that people may get emotionally overwhelmed. So, my reflection on the disillusionment phase and the risk and treatment. So, once again, I'm reading from the slides based on the video. During the disillusionment phase, disaster survivors realize that recovery is going to take longer than expected. So, they feel hopeless, abandoned, because the outside help that they were getting is getting smaller, closing in. They feel fearful about their financial future. They feel helpless. They feel angry. And so the interviewee states that there are early signs of PTSD, anxiety, and depression. She discussed how at 2 years the Jefferson Parish had an increase of suicide, and then year 3 she talked about how New Orleans had an increase of suicide, and then at year 5 the St. Bernard Parish had an increase of suicide. So she discussed how they advertised after they had a waiting list. They couldn't keep up with the numbers at their center, so they hadn't reached a pinnacle. So when she was talking about the stages of crisis, she basically discussed that it could go on for years. Then, in reference to what Miller states in the fundamentals of crisis counseling, after the heroic and honeymoon phase, the energy fades and survivors enter a point where reality sets in. And this is the phase where crisis can become chronic and emotional pain sets in. So, as the honeymoon fades, they enter into this disillusionment phase, and this often is marked by discouragement, fatigue, resentment, anger, and hopelessness. So, the types of clinical conditions that the people may develop based on the video and also research is anxiety disorders, depression, post-traumatic stress symptoms, substance abuse, or because people might use drugs and alcohol to temporarily deal with their pain, even though it's unhealthy. They're trying to avoid traumatic memories. Sometimes using drugs and alcohol are the only way they know how to cope with their grief and their loss. So they also may have depressive disorders, hopelessness, grief-related disorders, and especially when they lose loved ones that are close to them, they feel like they don't have the community stability, and they start to feel abandoned by the organizations that they feel should have helped, should have been there to help out. So I believe the types of treatment based on the knowledge from previous readings of crisis and trauma counseling, and after psychological first aid is administered, I feel like appropriate treatment might include trauma-informed therapy, addressing those biopsychosocial and that spiritual approach. I feel like this aligns with treating trauma and Christian counseling and that spiritual care that's needed after. I feel like support groups, community care, church, and faith-based support is so needed, like having community prayer, spiritual counseling, grief ministries that create a space for people to heal with healthy coping strategies, just giving them the resources to cope in a healthy manner. I also feel like that long-term follow-up and referrals, based on the video, they stated 3 to 5 years after disaster were the increased rates of suicide. So it's important for recovery and follow-up by professionals. They must be ready to walk alongside the survivors during this time, not only during the immediate response, but that long-term care. So I think this also self-care and resilience building is important, helping survivors and caregivers and their first responders understand those phases and normalizing their reactions to help them build resilience. So as I go into my personal thoughts about the video, which I feel like include the importance of the reconstruction phase. The video talked about the reconstruction phase and intervention. So I also want to discuss the interventions, providing during the pre-disaster phase, like providing training, helping people create disaster plans, and also like the Bible studies and groups. interventions in the phase just to be responsive to the community impact, to the honeymoon phase, like doing those surveys for PTSD and raising money. The interventions on the disillusional phase, like providing the support, extra support when those nonprofits move out, and then encourage hope and healing through Christ. They discussed also the Red Cross has neighbor to neighbor for psychological first aid. I think that impacts the community, especially after something like Hurricane Katrina, like a disaster like that. And then I also like that they mentioned celebrating the growth due to positive changes in the community when disaster strikes. The interviewee stated that the reconstruction phase is the place where the church can have the greatest impact, and I really believe that. So they also discussed the stories of real recovery where God can take a devastating event like Hurricane Katrina or other hurricanes, like even the hurricane that I survived through, where people are better after. And they also mentioned the term post-traumatic growth. I like that phrase because people come to seek help and they want to be resilient and they don't want to be stuck. So when the interviewee shared the story of the real recovery about the gentleman who went from pushing bodies after the storm down the Mississippi River, and how he battled drug and alcohol addiction, how he went through his relationship struggles, and how he even battled homelessness, that story was impactful to me because he went through all those things and he was able to find a healthy way to cope by joining the church and giving back to the community in a real way. And he was able to rebuild his marriage. And these are the stories of hope and resilience that I feel like God provides. I feel like it gives us so much joy. It gives me much joy, faith, and reassurance that faith-based organizations and church ministries, and the purpose of Christian counseling and integrating spiritual care toward healing and building resilience. I think that was the most important piece of the video that stood out to me, and that's why I wanted to also include the interventions in there and the recovery, like real recovery stories. So I feel like that's what helps build resilience. So I've included the following resources in my response. I use the Fundamentals of Crisis Counseling by Jerry Miller and the video resource provided by Houston Christian University Online Course Development, the video titled Needs and Challenges of Disaster. Those are my references.